The CDC gave its approval, so now the Pfizer vaccine can be administered to kids as young as 5 years old. 15 million doses started shipping out even before that ruling, so shots can be given as early as today, but more probably early next week. Joining me on the morning show, Dr. Sunil Joshi, president of the Duval Medical Society Foundation. Good morning.
Good morning, Bruce.
So a recent poll shows fewer than a third of parents say they'll get their young children vaccinated right away. That means 2/3 may not. Do you find that concerning?
Well, I think it's important for parents to understand that the American Academy of Pediatrics, infectious disease doctors, immunologists, and epidemiologists all over the country are very excited to have this vaccine available for this age group because of its safety and effectiveness. And it really is important for us to educate the parents that are concerned about this. And then there's a 91% effectiveness rate in this vaccine in these children, and that is even during the Delta variant. So very, very effective vaccines and very safe. And so it is concerning, but not surprising. And now it's up to us to educate folks about the safety of this vaccine.
And if they get the shot, they can go back to having sleepovers and parties and stay in school without having to be homeschooled. Now, there are some concerns about the Moderna vaccine for adolescents, and a decision on that was delayed because of worries about myocarditis. With this Pfizer shot, parents are asking, any worries? So your answer to them?
Well, keep in mind that during the study of roughly 5,000 children in this age group, there was not a single case of myocarditis that was found. Okay, so keep that in mind. Now, of course, as the vaccine starts to be given out and get more shots in arms, I do expect to see some cases of myocarditis. But remember that the myocarditis that seems to be related to the vaccine is incredibly mild and rare, whereas the myocarditis that is associated with the virus, with COVID-19 itself, is more common, about 10 times more common, and can be significant enough to require hospitalization. So again, the risks and benefits of the vaccine seem to weigh in the favor of getting the vaccine, even in the case of myocarditis.
And one of the big differences with this vaccine for younger kids is where it's going to be administered, in very familiar surroundings.
Yeah, I mean, the hope, of course, according to the Biden administration, is that as they ship out 28 million doses of the vaccine, is that we're going to get this vaccine into the hands of the trusted healthcare providers for children, which are the pediatricians' offices. That has been one of the biggest concerns of the vaccine rollout to this point, is not having the vaccine available at the ground level for doctors to give out to their patients. But in particular, when we're talking about this young age group, it is critically important that pediatricians have the vaccine available because the parents trust their pediatrician, the children have a relationship with their pediatrician, and it'll make the process go much more smoothly. And of course, if the patients or parents have questions, they can get answers from their trusted provider.
And the kids are going to get a lower dose than we adults.
Yes, that's right. And so this dose that Pfizer is recommending, or the FDA is recommended for children between the ages of 5 and 11, is 1/3 the dose that the rest of us received. And again, that lower dose is still effective, 91% effective, but does have less side effects associated with it. So less fevers, less muscle aches and joint pains, and some of the other things that we went through with the adult dose of the vaccine should be lessened with this lower dose.
And COVID rates are down in Duval, but epidemiologists say it's not time to let our guard down. Rates could rise this winter if we're not careful. How much could expanding the vaccination age impact the fight against COVID overall?
I mean, it's a huge thing. So this is another reason why we're so excited about having this vaccine available to this young group of people who are really the last major group that hasn't been vaccinated yet, because they're in school, they're interacting with each other, playing sports out and about, and they're interacting with grandparents and other folks that may be at risk of severe outcomes from the virus. The more of these young children that we vaccinate, the more likely we are to get through this pandemic. And so, yes, it's very important that we get this group vaccinated. Hopefully, the vast majority of parents will agree to do that.
Dr. Sunil Joshi answering questions that I know a lot of parents who are watching have. Appreciate you.
Thank you, Bruce.